So today we're talking about immediate sciatica relief in your house. And so if you've just had an acute bout, which means a recent bout of sciatica, you're going to be looking for things that are going to give you relief at home, things that you can do that are safe and effective. And as a physical therapist, I do this with people all the time. So we're going to go over some caveats and some tips and tricks that I've shown people to give them some immediate relief while trying to avoid unnecessary imaging and medication. So these things are going to help you feel better right away. Now you have to remember, sciatica is pain down the leg. So it's glute pain or hamstring pain or foot pain and numbness and tingling. So if you're having those symptoms, I feel like you're going to get something from this video. Here we go. Let's talk about the 5 things that I always tell my patients. So let's talk about sciatica. So sciatica is pain down the leg with numbness and tingling. Now you notice I didn't say pain in your lower back. It doesn't have to be in your back, but it's actually originating from your back and typically from the lower lumbar spine, L4, L5, or even L5, S1. And so some of that disc material is kind of pushing towards the nerve. And so sciatica, in its true definition, is just a space issue. You're running out of space near that nerve, and now it's irritated. And that irritation is causing a severe amount of discomfort, which can be in your glutes, or in your hamstring, your leg, your foot, or maybe even just your foot, numbness and tingling in your foot, but it's actually coming from your back. And so when I'm working with people and I'm telling them these tips to make them feel better at home, we need to first identify if it's truly sciatica. And I have a previous video that we talked about sciatica versus piriformis syndrome, because a lot of people think they have that. So check that video out if you have any questions or you want some clarity around that. So we're going to be talking about sciatica, and the first tip that I would say is you've got to prevent sitting for a long period of time. And so sitting is a flexion moment of your lumbar spine, of your lower back, and it's going to push some of that material and irritate the nerve. And so if you notice, if you have true sciatica, sitting on a soft surface such as this table or a soft dining room chair or your couch is going to cause an increased amount of symptoms, either in that moment or when you try to get up. And so it's not causing damage to the nerve, but it's causing an increase in symptoms. And so a lot of people don't want to have an increase in symptoms. So sitting in a hard chair in a little bit more of an erect posture is a great tip to give you less discomfort down your leg and to help protect the nerve while it's trying to heal throughout this acute phase. The second tip being medication. And so I don't often recommend medication because it's not a great long-term solution to pain. But in the short term, when you're having an acute bout of pain down in your leg or numbness and tingling, it can be a great way to help you get through your day. So my first answer to that's got to be you should consult your physician and see what medication you tolerate best. But simple NSAIDs, or just non-steroid anti-inflammatory drugs, can give you a way for some relief without having like the adverse event. And so you would know if you can't tolerate one of those medications or if you tolerate one better than another. But those medications have actually been shown to be very, very effective for pain. And actually, when you compare it to the long-term to higher like pain medications such as opioids, they actually compete very well. And if you notice people who've had surgery, I treat people right after surgery, they don't even give them opioids anymore. And so these medications can be really effective to help take the edge off the discomfort so you can just function more, go to work, and just go about your day with some less discomfort. So let's talk about the third tip. The third tip being ice or heat. People are often asking me that. They're like, hey, I have a hot pack, I have a cold pack. Which one should I be using for sciatica? Well, I have to remind you that sciatica is actually originating from your back. You may feel the pain down your leg, but it's actually coming from your back. So if you're going to be using ice or heat, it's going to be on your lower back. In my preference, I would recommend using heat laying on your belly. That's going to give you some of that extension moment, which standing feels better than sitting. So if you're on your belly and you place that hot pack on your back, that's typically what I recommend. You'll notice that a bath or a shower feels better than a cold pack. Now, because what's going on in the back is so deep, there's a lot of tissues there, the ice doesn't really penetrate that well. So I do recommend using heat. Laying on your belly, 15 to 20 minutes of having that hot pack laying on your back, have someone help you out, and just try to relax into that position. 15 to 20 minutes, and you have to wait 15 or 20 minutes before you do it again, but you can repeat that process as much as you would like. Generating heat in that area will help relax the muscles and the tissues, giving you some relief. So the fourth tip would be movement. And when you look at the research to improve sciatica in the short term and the long term, movement is key. And so is exercise, but we're going to get to that in a second. And so when we're talking about movement, it usually comes in the form of just not staying still. I tell my patients it's not great to lay in bed. It's not great to sit in your couch and just to let your body kind of just stew in that inflammatory process and give yourself more symptoms. You want to stand up and walk. And so standing feels better than sitting, and then walking helps nourish the the nerve. It helps move that inflammatory soup, the stuff that's giving you pain, out of your lower back and away from that nerve. And so walking is actually very good. I'm not saying it's pain-free or even soreness-free, but in the long term, I've seen people recover faster and better when they're incorporating walking throughout their day when they're going through this sciatica healing process. So exercise is very effective for treating sciatica. It's about what and when. And when you're having this acute bout, this early bout of sciatica that's really painful, sometimes less is more. So we talked about walking. Getting up and walking is really good. But then typically I go over just 2 exercises that I want my patients to do when they're having this acute flare of sciatica. And so we're going to go over those 2 exercises, but it's worth noting one specific principle along the way, and that's called centralization or peripheralization. What that means is that when we're going through these exercises, you should never have an increase in symptoms in your leg that is moving away from your spine into your periphery or into your legs. And so you don't want that to happen. If it's happening in your buttock or back, that's okay. But anything away from your body, we want to try to stay away from. And you'll hear me say that as we're going through the exercises. But we're going to go over the top 2 exercises that I give my patients when they're having that sciatica and they want to know what can they be doing at home to make themselves feel better. So the 2 exercises that I give my patients are nerve glides and actually just laying down. And so we're going to go over those 2 things right now. So the nerve glides, remember, they're there to improve space movement and blood flow of your nerve. And so I'm going to step you through the exact things that you should be feeling and how you should be doing it. These are effective, but if you overdo it, you're going to feel it. And if you underdo it, you will not have the improvement that you're looking for. So I'm going to go over that right now. So these are nerve glides. We're going to start off with the basic nerve glide because I'm assuming that you're having a lot of discomfort. So we're going to have one leg fairly bent, and then let's assume it's my right leg that we're having symptoms. So I'm going to lay on my back. I'm going to keep the left leg fairly bent. I am going to have my hands behind my knee so I can be nice and relaxed into this position. And then what I'm going to do is just use my muscles and kick my leg or my toes towards the ceiling and then pull back my toes at the first point of resistance. And so I'm not doing it as high as I can. I'm just feeling it where my body kind of tells me to stop. I go up and I pull my toes back. I kick up and I pull my toes back. Now let's assume that when I pull my toes back, I feel the symptoms down my leg or my glutes or have an increase in tingling. That is okay, that is normal. Motion is lotion when it comes to the nerves, and so we want to use this movement to improve the blood flow into the nerves. And as if I'm having any increase in symptoms in my foot, that's peripheralization, and we do not want that. But if I'm having buttock pain only and no leg pain, that's centralization, and we do want that. And so we're going to be doing this exercise 20 to 30 reps so we can improve the nourishment around the nerve and the blood around the nerve as well. That is how we heal. We need that blood around the nerve. So I'm going to kick my leg straight and pull my toes back. You will feel your quad burning, the front leg muscle, and that is normal. We just have to get through that. But you're going to kick and pull your toes back. Kick and pull your toes back. Now, if you could tolerate the leg straight on the other leg, then do it. That's completely fine. But this is like a level 1 nerve glide. So we're going to be kicking up towards the ceiling and pulling your toes back, 20 to 30 reps, 2 sets of that. And so in between sets, I just say, get back into a normal resting position. You're going to take a break for a second and just see how you feel. If you're having some symptoms in your buttock or your lower back, that is completely fine. If you notice that you're having increased tingling or pain into your foot, that is not fine. That is not what we want. So you're going to be doing the same exercise again. We'll be 20, 30 reps. We're using this nerve glide of kicking towards the ceiling and pulling your toes back. Kicking towards the ceiling and pulling your toes back. So that's the level 1 nerve glide. And I do recommend that for people with having acute bouts nerve pain or sciatic pain. Now we're going to go over the second exercise, which is much simpler, and that is simply laying on your belly. So I'm going to try to transition on my belly. And I do recommend this. People do this like in between commercial breaks and TV, and they're just going to either rest on their belly like you're sleeping, or you're going to prop up on your elbows and just relax your lower back. Remember, I recommended walking earlier because walking is an extension-based exercise, and if you stand me up, it's like I'm just extending my back because our backs and the sciatic nerve loves it when we lay on our belly versus when we bend over. And so we're going to lay on our belly for 1 to 2 minutes, and then you'll sit up and take a break. And then 9 times out of 10, I do see that it helps relieve the symptoms into the foot. And you may have an increase in buttock or back pain, but remember, that's centralization. That is okay to have right now. And so we're going to relax in this position, 1 to 2 minutes, do it a few times every single day, and that's going to help give you some relief that you could be doing on your own at home. Not hard, but very effective. And so using the nerve glides plus laying on your belly can help get you through some of the hardest times of sciatica. Now, that is just scratching the surface of the sciatica relief, sciatica rehab program, but those are some great things that you could be doing to start off right away that are safe and effective.